Hello, my name is Caitlin McCarthy. I'm in SPCE 638, Section 800, and this is my first case study. This case study will focus on Student A. Student A is 5 years and 7 months old. His diagnoses include autism spectrum disorder and significant developmental delay. I see the student in a self-contained classroom. His peers include 6 other students with ASD and STD, and his peers range from grades kindergarten to 5th grade. He is in kindergarten. The classroom contains 1 special education teacher and 2 paraprofessionals. And the concerning behaviors at this time are elopement and throwing. His communication, he generally communicates his wants and needs using 1 or 2 word phrases, or he'll pull staff and point to what he wants. But he is able to ask for help verbally and say some reinforcers that he wants. He can also say no, thank you, in addition to throwing to communicate that. Possible contingencies that are already in place are some negative reinforcement when the student throws items and has to clean them up, or when the student elopes, it postpones having to complete the next task. Even when the next task is something that he would like, he just doesn't like it as much as he likes playing independently. And transitions, therefore, are pretty hard. Positive reinforcement, when the student elopes, a staff member will retrieve them and attempt to physically guide him. This provides him with a lot of sensory input and attention. I think the sensory input seems pretty huge for him. So like put his body on teachers and he'll like kind of pretend to hit. I think he is kind of seeking that sensory piece. When the student throws items, staff members require him to clean up the items. This provides him with additional access to the items. He'll start to pick up and then he'll throw the items again, I think just to possibly to prolong that access. A functional behavior assessment was conducted, and this included partial interval data collection for 5 days. That is the data collection system used in the classroom, just because there are 7 kids with data being collected. So staff has shared that that's their easiest method versus frequency or duration. ABC data was collected for 5 days from paraprofessionals and the teacher, depending on who was working with him. A parent interview was conducted over the phone, and 2 specialists were interviewed, his speech and language pathologist and his occupational therapist. 5 direct observations were made across all settings. Student A travels between occupational therapy or motor lab to the cafeteria each day, to his classroom, and to recess. So he is he is in a lot of different settings, and there's a lot of transitions. For our operational definitions, elopement includes any instance or attempt to leave a designated area by 4 or more feet without permission. And throwing includes any instance or attempt to move objects not intended to be thrown through the air farther than 1 foot using any part of their body. For this particular student, it most often includes swiping or pushing items off of his desk or table, but will occasionally involve picking up and throwing, typically work. Some motivating operations to consider is satiation. The student may become satiated with the classroom toys that he is currently motivated by. So to combat that, toys should be rotated each week to avoid satiation. Some setting events that may be impacting the student are that he gets less sleep on nights that he spends at his dad's house. He spends a few nights a week at dad's house and a few nights a week at his aunt's house. His dad's house is about an hour away from school, so he's getting significantly less sleep on those days. And we have noticed an increase in behaviors on those days. When the student has been ill, there have also been increased instances of target behavior, and it is the beginning of the school year, so illness is pretty rampant right now. Some environmental modifications and antecedent strategies include providing the client or student with a visual schedule containing the activities of the day. The student's desk should be kept clear of any unneeded items so that if there's throwing or swiping, there's just less to throw and swipe. It's easier to block. Keep preferred activities out of reach until they are available. And a staff should be positioned between the student and the door to prevent eloping from the room. We'll also be using a timer to show the student how much time they have left with their preferred activity. And we will warn the student a minute before transitions, 1 minute before their preferred activity will be removed. The intervention that we're going to be using is an antecedent intervention, the PREMAC principle. This procedure will first identify preferred and non-preferred activities. This was done using preference assessment. His preferred activities include puzzles, Legos, and trains. Legos, it's kind of an all-encompassing term. He likes any sort of building activity, connects, blocks, stuff like that. Non-preferred activities include whole group lessons or activities, anything that involves waiting. This can even include the last bit of lunch when he is done eating and wants to get up and go back to the classroom. So even if it's not waiting for a non-preferred activity, he still struggles with that, and any paper-based work. So those have been identified. Next, we'll present the contingency to the student using a first then visual. Our first then visual includes a work icon and a play icon. When the student completes the non-preferred activity, access to the preferred activity will be withheld until the non-preferred activity is complete. When the non-preferred activity is complete, you will gain access to the preferred activity or the toys. We'll be using an extinction procedure. So when the student elopes, we will block the exit of the room, but provide minimal attention and physical contact, just because of that sensory piece. And we'll continue to withhold the preferred activity. When he throws preferred items, we'll remove the items and represent the contingency. Right now, staff has been having him clean up the toys, but as previously discussed, that may just be providing reinforcement for throwing because he gets more time with the items. So we will remove the items and then represent the contingency with the visual. If he throws a non-preferred item, like paper-based work, classwork, we'll block when possible, gather the thrown items, and represent the contingency. When he completes the assigned task, we will grant access to the preferred activity, provide verbal praise, squeezes, and tickles. The squeezes and tickles are actually more enforcing than the verbal praise, but they usually go together. Provide the student with a timer showing how much time they have with the preferred item. Our schedule of reinforcement will be a fixed ratio in FR1. Each time the student completes a work task, he gains access to a preferred activity and tickles or squeezes. For generalization and maintenance, paraprofessionals and specialists will be trained on the intervention. Well, we're trained on the intervention and antecedent strategies and environmental modifications. As previously mentioned, he does go out for occupational therapy. He should be going out to speech. However, when we had started the intervention, he was doing speech in the classroom. All that to say that when he goes out of the classroom, the staff that he's seeing there should be trained on the intervention. First then chart traveled with the student to all locations, to the classroom, to motor lab, speech, recess, and cafeteria. I offered some training to his parents on the intervention and provided them with their own chart to use at home. His dad is very involved with his education, was very interested in his training, and he has reported that it's been going well. Upon mastery, regular classroom data collection procedure will be continued. There's already partial interval recording procedures for all the students right now, so they'll just continue to take that same data. And then eventually, upon mastery, there will be a systematic fading of reinforcement. So we will fade prompting from visual to verbal by removing the first, then visual. Staff can just say first work, then play. And we can move to a VR, or actually I'm at FR2 schedule of reinforcement, just to get him used to doing more work before getting that free time. So here was our outcome. After 1 week, the elopement had decreased from 50% of intervals to only 10%, and throwing decreased from 60% to 10%. This was huge and great. After 2 weeks, elopement had then increased from 10 to 20%, especially during transitions between locations. When he had to walk through the hall, there was increased elopement then, and throwing increased from 10% to 30%. Some possible explanations for this increase: during week 2, there was an increased number of transitions. That's when student A began attending speech outside of his classroom. Also, during week 2, the student's usual staff member, who was kind of the unofficial one-on-one, was out for 2 days. So there may have been some inconsistency in how the intervention was being implemented. Some obstacles that we faced during this intervention: it was a bit difficult to convince staff. I live in South Georgia, and there is kind of one disciplinary style, it feels like, down here. So it was a little tough to convince the teachers to not make the student clean up the things that he threw and to not use physical prompting. I did show them the data after week 1, and they were surprised and more willing to continue the process through the next week. I've not shown them the week 2 data yet. I'm hoping that that doesn't crush their spirits, but we will remain consistent and hope for the best. So that is my case study.